Good afternoon. I'm Riley Miller. Breaking news happening right now. Georgia Governor Brian Kemp is holding a news conference in Atlanta with the latest in the state's efforts to deal with the COVID-19 pandemic. Let's listen in live right now.
Natural resources, and wrap us up today. We've got our Agriculture Commissioner Gary Black. For several months, our nation, as you know, has been fighting an invisible enemy and uniting to ensure the health and well-being of all Americans. The path has been long and difficult, and everyone is making sacrifices to keep one another out of harm's way as we fight to stop the spread of coronavirus in communities all across the United States. Medical providers, public health officials, frontline workers, first responders, law enforcement, they're all working very long hours and spending significant time away from their families to help limit potential exposure. These brave men and women are literally saving lives every day. It is impossible to thank them enough for what they've done for us, but I know that countless Georgians join my family and I in praying for them daily. As you all know, this weekend is a powerful one for all Americans. For years, we have taken this moment to reflect on the sacrifice made by those in uniform. We honor these American heroes who answered the call of duty and paid the ultimate price for our freedom. Earlier today, I was honored to attend a Memorial Day ceremony with the Georgia National Guard to honor the lives of retired Master Sergeant Mark Christopher Allen and many other American heroes. Master Sergeant Allen's family, fellow service members, and many others were in attendance as we took some time to remember those that we have lost and acknowledge our many blessings as Georgians and Americans. This year, Memorial Day will be even more powerful as we find inspiration from our fallen soldiers. We need their encouragement and commitment now more than ever. While this battle against COVID-19 is far from over, I remain encouraged by the data and the feedback from public health officials. As you know, testing remains a top priority as we take measured steps forward. In addition to rapidly increasing testing capacity, we have also seen a steady decline in the percentage of patients testing positive for COVID-19. This is a key data point and a real testament to the hardworking Georgians everywhere who are following the guidance, wearing masks, and practicing social distancing. While inconvenient at times, these proactive measures are truly paying off. I'm proud of what we accomplished over the last several weeks, but we cannot rest on our laurels. We need to further expand access to testing, and we need to encourage Georgians to make it a priority. This morning, we were proud to announce that CVS Health is opening 23 new drive-through testing sites across Georgia. Now, more Georgians and more communities will have access to convenient and quick COVID-19 testing options. I want to thank CVS President and CEO Larry Merlo and his team for their commitment and strong partnership in our state. I'm also excited to see that several Georgia companies have partnered with Augusta University to help accomplish their mission in the fight against COVID-19. Our friends at SK Innovation recently joined numerous businesses and organizations in financially backing AU's efforts. And earlier today, Augusta University announced a partnership with Sharecare, the state's official wellness vendor. Through the Wellbeing Georgia website, Sharecare will help members of the state health benefit plan access vital tools and resources to keep their families safe and sound. This website drives traffic to the AU Health Express Care app for free virtual COVID-19 screenings, 24 hours a day, 7 days a week, with no appointment and no cost required. Again, we are so grateful for these types of partnerships that are helping us move the needle in this fight. Speaking of making progress, we reached another milestone this week. As of today, we have less than 1,000 COVID-19 patients hospitalized in our state. GEMA's 1 p.m. update has that number at 919 patients. This is a 38% drop since May the 1st. I want to especially thank our hospitals, large and small, for working with us over the last several months to enhance surge capacity. And as always, I want to thank the frontline workers for helping to nurse these patients back to health. As a reminder, Georgia's health systems are ready to serve patients for elective procedures and routine appointments. I want to strongly encourage everyone to get important checkups on their calendar. In the past few days, we've seen reports that some of our largest, most successful hospital systems are having to, believe it or not, furlough staff in the midst of a pandemic. Please go to your doctor for a checkup if you are due for one. Schedule time for routine procedures like dental cleanings and eye exams and other tests that can prioritize your health. One of the most aggressive actions taken to the battle in the spread of COVID-19 in Georgia has been the disinfection efforts undertaken by the Georgia National Guard in our long-term care facilities, including nursing homes, assisted living facilities, and personal care homes. The Georgia Healthcare Association, the Georgia National Guard, and GEMA have been discussing best options to continue these efforts to protect our senior citizens and others that are in these facilities. Working together, they had developed a plan that I have approved to continue the disinfection efforts in all 790 senior living facilities across our state. This strategy has a three-pronged approach. First, the Georgia National Guard has produced and will be providing an instructional video on how to safely and properly disinfect these facilities. Additionally, GEMA has purchased and will distribute industrial foggers, disinfectant solution, and appropriate PPE to 353 nursing homes. And we anticipate that those supplies will be delivered within the next 4 weeks. Our PPE shipments will mirror a recent 7-day supply of PPE that we received from FEMA to nursing homes as part of their Operation Commitment to Care. I certainly want to thank President Trump, Vice President Pence, and the task force for supporting this recommendation, and certainly to Director Gaynor and FEMA as well for their support. In total, Georgia will be sending approximately 14,000 face shields, 161,000 masks, 749,000 gloves, and 35,300 gowns to our nursing homes. Finally, we have worked with these facilities to ensure that they incorporate disinfection efforts into their regular cleaning schedules and follow the appropriate guidelines. Across the nation, the 2020 census is underway to ensure an accurate count of the population every 10 years. This effort plays a vital role in allocating representation among states and funding large-scale projects like infrastructure, health, and education. The amount of federal funding that we receive for these projects depends on our state's population and participation. And right now, Georgia's response rate is 55.8%. That is lagging 3.8% behind the national rate. I want to ask all Georgians, if you have not responded yet, visit my2020census.gov or call 1-800-330-2020 to respond. Before I turn the podium over to Dr. Toomey, I want to take just a moment to address a recent data reporting concern involving the Georgia Department of Public Health's website. I have said from the very beginning that we are making decisions based on data, science, and the advice of public health officials like Dr. Toomey. We are committed to full transparency and honesty as we weather this healthcare crisis. Georgia families, businesses, local leaders, and the press deserve accurate data, and I know that Dr. Toomey's team is working around the clock to collect sort, and produce that information. We are truly blessed to have one of the best public health directors in the nation leading our state through this pandemic, and her team is working around the clock to ensure the health and well-being of all Georgians. They are taking massive amounts of data from countless sources, putting them into accessible format under a global spotlight, all at breakneck speed.